This is Core Conversations with Natalie Baggio.
Welcome to Core Conversations. I'm Natalie Baggio. We are excited to kick off our new series about services close to home. In the coming episodes, you will learn about new services that we have within our community, growing and expanding services, and our goal is to ensure that we have care that's sustainable right here within Southwest Michigan. Our first episode is about cancer health, and I'm joined by Andrea Baumann, our Service Line Director of Cancer Care. Welcome, Andrea.
Hi, Natalie. Thank you.
Thank you for being here today and joining me on the podcast.
It's my pleasure.
Before we get into the conversation, I want to give you an opportunity to share with the community your current role and some of your past experiences and why you're passionate about cancer health.
Sure. Thanks. It's a pleasure to be here today. So I'm Andrea Baumann, Senior Director, Inpatient Care Services at Corewell Health South. I have been with the team at Legacy Lakeland for almost 15 years, and I've had a number of different positions across our continuum of services, including nursing leadership, our quality programs, physician practice administration. And so I now have responsibility for several different service lines, including our cancer teams here in the South region.
I remember the first time I met you, you were working with the hospitalist team and managing inpatient care.
Yep.
And now you're on the outpatient side and you're helping with screenings from preventative all the way through the continuum of care for cancer health and working with a multidisciplinary team. So I'd love for you to share with the community, kind of just starting with screening and the health of cancer. Like, what are some of those steps that our community could take for preventative?
Absolutely. So cancer health is a team sport, and it's also a continuum. And so we like to start all the way from the beginning, from the prevention and screening aspect. And those things really are a part of how we think about our care in partnership with our primary care physicians, with our things like family history, risk factor management, and those things to help drive us through those screening pathways. There's many different types of screening, anything from the things that you might think about that are more well-known with mammograms or things like low-dose CTs for lung screening for patients who may have a smoking history or additional risk. And so those screenings and prevention can really be most effectively managed with your primary care physician. On the prevention side, there is just a lot of work that we can continue to do on ourselves and our health and well-being to ensure that we're making healthy choices. We are paying attention to our nutrition and our weight and avoiding things that are higher risk like smoking, alcohol use, and really focusing on health and wellness as a way to try to stay clear of cancer.
You mentioned a couple of screening opportunities. What would be the best way for, if the community's interested in any of those, how do they get started in those sorts of programs and screenings?
Sure. Most cancer screening pathways start around age 40. So that's, that's our cohort of folks, right? And so ensuring that you're paying attention to going to your annual exams with your primary care physician, talking with them about your family history and your personal risk factors, and then they will help individualize those screening pathways for you to ensure that you are accessing care at the right time for your health needs and helping to identify anything that might be coming along as early as possible, because we know that when we catch cancer sooner, the outcomes are better and patients have a more clear path forward than if we catch it later. And so those screenings are the most important way to be sure that we can do that.
So really starting with your primary care doctor, have a conversation, and they can help set you on that right pathway.
That's right.
So if you have a diagnosis of cancer, which can be extremely scary, what services do we offer? How do we help patients through that situation that can be really ambiguous?
Absolutely. I think that probably most of us have had an experience with someone who has cancer, whether ourselves, a family member, a friend. And as you said, it can be one of the most scary moments of someone's life is learning that they have cancer while they are not yet sure what that plan will look like.
Right.
And so our multidisciplinary team is here to help. We have an incredible team of experts on the physician and provider side those teams have nurses and medical assistants and pharmacists and layers of folks to come alongside our patients and help them get on track right away so that we can establish a plan of care and start the patient through that trajectory. Another role that we have here at Corewell Health South is our nurse navigators. And our nurse navigators are, as their name suggests, nurses who have a great amount of experience in cancer health care. And it's their job to help come alongside and partner with our patients to make sure that as they're going between all of these different physician specialists or physical locations, that they're able to help act as a single point of contact for that patient, help reassure them that they're on the right track, or identify where they can best point any questions that they have about their process. Our nurse navigators are just absolute gems. I love talking about them, and they're wonderful, and they help ensure that our patients have a sense of personal connection while they're going through a very difficult time in their life.
Yeah, and being someone who has been on this journey with a family member before, that nurse navigator was a lifeline.
Yes.
That really was able to answer questions or understand why you need to take the next step in procedures, testing, whatever it may be, to give that deeper understanding.
Sure.
And help eliminate some of the fear.
Absolutely.
And build the confidence in the process.
And it's very overwhelming, right? Yeah. You're processing the diagnosis while getting information from all different angles on what your treatment might look like. Teams are making recommendations, and then you're kind of bouncing between all of these things. But our teams are here to help across the board. And we have an incredible team of experts here locally that are here to serve. And I think one of the most important pieces as people are thinking about where they might choose for their cancer care is to think about ensuring that we can provide great care close to home. Yeah. So as you start off on a cancer care journey, oftentimes, as we're talking about, patients have a lot of appointments. There's a lot of different specialists to see. They may be starting chemotherapy or radiation therapy. And those appointments can sometimes be quite frequent. You may need to see your physician because of your response to those treatments. And so being able to access care here close to home is so important because that allows our patients to then focus on themselves and the rest and recovery that they need while they're on track, instead of spending lots of time on the road traveling to and from other places. So we do offer services here in St. Joseph at the Maria Yeager Cancer Center and also in Niles. And so wanted to make sure that we can allow our communities to be able to stay here as much as possible so that as they're going through this difficult time, they don't have to be layering travel into that complexity.
Yeah, and transportation can be challenging at
Absolutely.
times. And being able to see your medical oncologist in St. Joe or Niles helps keep that care close to home. And if you do need chemo, we have the infusion clinics in both of those locations as well.
Right. That's right.
That's really great. So our cancer program is definitely something I know you and the team are very proud of. What could you share about the outcomes of the program or the experience that the patients have going through this program?
Sure. I'll share a couple of pearls. So we are very proud to hold accreditations from the American College of Surgeons, who is a national organization that helps indicate a sense of quality and positive outcomes in the form of that accreditation. And so we hold the Commission on Cancer Community Health accreditation as well as their breast cancer accreditation. So that's demonstrating that our outcomes are top-notch. And we do that through a process where we submit our data, we submit the quality improvement work that we're doing so that they can assess the quality of our program and indicate, and share that quality story alongside us. From an experience perspective, there's a lot of great things that I think we offer. One thing that I'll highlight is the ability to really personalize that care, as we've been talking about. Cancer health is a space in medicine and in healthcare where the science is changing so quickly, which is very exciting. And what that means is that patients who are going through chemotherapy, radiation therapy journeys are experiencing less difficult to tolerate treatments over the course of time. People are living longer, they're surviving with greater outcomes, and that's a wonderful thing because we know that all of our patients are people in the community, their family members, their employees, their mothers and fathers, right? And so we want people to be able to live that part of their life in a very rich way. And so one of the elements of cancer care that's becoming a very predominant part of how we think about treatment planning is genetics. And so you may have heard of genetic counselors and the different types of genetic work that you might hear in other kinds of service lines as well. We have genetic counseling here at Corewell Health South, and those decisions that can be made based on people's personalized genetic profiles and risk factors can really help to guide treatment to ensure that that is closely connected to their own risk factors and their own decision making around their health. So certain kinds of cancer have a closer or stronger connection with genetics than others. And so not every cancer care journey needs to have genetics as part of their workup or part of their evaluation. But for those who would benefit from it, our teams are able to access that close to home.
Yeah, that's really great. And if our community is interested in learning more about our services, what would be your advice for them to explore and be able to contact us?
Sure, absolutely. So as you mentioned, we have services both at St. Joseph, at the Marie Cancer Center for a lot of our services. Our radiation therapy team is housed at the hospital in St. Joseph. And then in Niles, we have infusion and medical oncology services at the medical office building. They're just across from the hospital. But our cancer continuum, those teams that contribute to cancer care and the patient journey are deep and wide. So we partner with all kinds of different specialists, from surgeons to our support teams and nutrition and physical therapy, and we talked about genetics already, and many others. And so you can find out more information about the services that we offer, as well as different types of cancer that we treat and treatment pathways that we offer within our system on our website.
Okay. Well, thank you very much for joining me today, and thank you for your leadership. I know you have a lot of passion behind this work, and you and the team are just doing a great job to continue to expand our services and ensure that we have services close to home for our community.
Thanks, Natalie. We're blessed with a great team in cancer health here, and we're very proud of the work that they do. Yeah. And they have just a passion for the patient care that they deliver in a way that is very inspirational. So thanks for letting us have a chance to talk about that today.
Yeah, thank you.
Thanks.
And thank you to our listeners for joining me today on Core Conversations.